House Bill 2024. Virginia has legislated health insurance policies that are unaffordable. Health insurance coverage is financially out of the reach for many lower income workers. In Virginia, we have over 1 million citizens that do not have health insurance, and one of the main reasons is cost. House Bill 2024 will provide an opportunity to increase the number of individuals with health insurance and to decrease the number of uninsured. By health coverage, previously uninsured individuals will be able to access care. Providers such as physicians and hospitals who have provided uncompensated care would be able to receive payment for their care rendered. House Bill 2024 includes 3 components designed to help individuals who are currently uninsured gain access to health insurance. Number 1 is insurance products that would include all of the mandates, but the benefits would be capped at a specific dollar amount. This would allow consumers to have access to preventive services that are so crucial to controlling chronic conditions. Number 2, another position of this bill will allow employees and insurers to design benefit plans that fit their needs and budget. And number 3 is the final piece, which use CPON process to allow hospitals, charitable foundations to help fund insurance coverage for uninsured, low-income workers, and insurance premiums costs could then be split between the charitable fund and the employees of the employees. I would now like to turn it over to Julia Hammond, who is the State Director of the National Federation of Independent Business.
I'm here to talk about House Bill 1598, which was related to the Certificate of Public Need. That's a very complex law in Virginia, and so I'll try to break it down as simply as I can. Healthcare providers that want to either build new healthcare facilities or offer new services have to get permission from the state and demonstrate that there's a need for this facility or this service to be offered. And House Bill 1598 seeks to streamline that process. Current law has 21 criteria that the Commissioner of Health is supposed to examine in looking at these applications. In talking with the Commissioner and the administration, they readily acknowledge that there's only a few of those criteria that they actually focus on. So what we did this year is we introduced legislation that reduces the number of criteria to be considered from 21 down to 8. And those 8 criteria focus on increased access to care, affordability, institutional competition, and those are critical to providing services to the citizens that we seek to serve. In addition to that, there's an expedited process for the conversion to psychiatric beds. The growing demand for community-based services within our mental health system requires the ability of the industry to move more quickly to create those facilities for psychiatric beds across the Commonwealth. And as Delegate Marshall mentioned earlier, there is also the provision where hospital systems can count their charity care and their services to the indigent in meeting the financial obligations related to the Certificate of Need purpose. With that, I'll turn it over to Delegate Nixon.
Thank you.